Good morning, everyone, and welcome. Thank you so much for joining us for this Healthy Living lecture event on optimizing virtual care services for better health, hosted by Henry Ford Senior Living Program. My name is Maggie Jackson, and I will be your moderator this morning. I'm the manager of Medicaid and Medicare marketing at Henry Ford, and I also oversee Henry Ford Senior Healthy Living Program. This morning, you will hear from Dr. Siddiqui, physician lead of My Care on Demand at Henry Ford Health. Dr. Siddiqui will discuss the benefits of having a virtual visit, the health concerns best suited for a virtual visit, and the technology needed to participate in a virtual visit. You will receive valuable tips and resources to help you be successful with your virtual visit with your provider. Following the presentation, we'll have a Q&A session. So if you have a question after Dr. Siddiqui's presentation, please type your question into the chat box, and please do not share any personal medical information. Also, to ensure a smoother experience for all, please turn off your camera and note that your microphones have been muted. This lecture is being recorded and will be available to listen to again on the Healthy Living Lecture Events page at henryford.com/Healthy Living Lectures. And now I am very pleased to introduce Dr. Siddiqui.
Thank you, Maggie, for the introduction. Good morning, everyone. I appreciate you joining the webinar today for optimizing virtual care services for better health. My name is Dr. Afaaq Siddiqui. I am a family medicine doctor at Henry Ford and the physician lead for the My Care on Demand video visit services. Moving along. For our agenda today, we will be defining what virtual care is, the different types of virtual care, modes of healthcare delivery, and how best we can incorporate virtual care services to your existing primary care to better serve your needs. So, primary question, what is virtual care? Most of you have probably used this in some shape or form, so let me define it for us. Virtual care, also known as telehealth or telemedicine, is the delivery of health-related services and information through electronic and telecommunication technologies. Fancy word for saying phone and video, basically. The types of telehealth are essentially two types. One is synchronous, which is a live two-way communication platform between the patient and healthcare provider. For example, this includes remote consultation using video visit. We have our own Epic platform, but Zoom, Skype, Microsoft Teams all come in that category of synchronous video visit communication. The other simpler way is a telephone visit, which is live two-way communication between a healthcare provider and a patient on the telephone. The second type is asynchronous, which means it is not real time. It is not two-way. It is store and forward telemedicine. Information is collected over time and then shared with either the healthcare provider or the patient. Examples for this are MyChart messages, electronic visits, e-visits. Moving along, let us go and talk about the traditional modes of healthcare delivery that we now possess. So we have our in-person office doctor or healthcare provider consultation, where patient goes in, waits in line, seen by the doctor, and gets their lab visits, vaccinations, and everything else. Now you have your nurse visit where you just see the nurse for certain medication administration like pain shots, birth control, etc. You have the medical assistant visit where it may be for blood pressure checks and some vaccinations. So these are our traditional modes of healthcare delivery. There are obvious benefits to this. You could be having a detailed examination, physical exam, and it is suitable for many medical conditions. You can complete lab work and vaccinations in the same visit, and of course, you get to see your doctor in person. Now, some of the challenges with this might be hard to get an appointment in time if the office is running behind or your doctor is on vacation. Transportation would need to be arranged, which may be difficult for some people, and potential waiting times in the office if the staff is running behind. These are some of the challenges that can come with in-person visits. Now, if we talk about virtual or telemedicine healthcare delivery as another form of providing care, it can incorporate in a few ways. We have the video visit, we have the telephone visit, and the electronic visit. So as I had mentioned before, video visit is live two-way communication where you use your cell phone, tablet, or computer and talk to your provider on the video, similar to how you would in person, but electronically. Telephone visit is two-way communication through the phone, and e-visit is asynchronous visit where you answer some predetermined questions, write up what you need to know, and then you forward it to the doctor. The doctor or the healthcare provider looks at the information, comes up with a treatment plan, or asks you more questions if they have, and they send it to you, and then you reply back later. So these are some virtual medicine healthcare deliveries that we have. There are obvious benefits to this thing also. Can be done remotely from the comfort of your home or office, potentially quicker appointments and reduced wait times, reduces transportation burden and more efficient with your time, and probably also providing value for money. Some challenges that come with telehealth services is that it may not be appropriate for all medical conditions. So it is important to know what it is good for and what might an in-person appointment be better for. Limited physical exam capability and technology. Technology tends to have a small learning curve and sometimes can be finicky, but as time goes on, this will get better. And most of us already use most of this technology in our daily lives. So it will just be incorporating it in our healthcare services. So how do we do that? How do we integrate virtual care into primary care for enhanced value? We'll talk a little bit more about that, which I'm hoping you will find valuable. So to do this, first we have to define what primary care actually is. So primary care is typically the first point of entry for most patients into the healthcare system. It should be easily accessible to individuals, providing timely and appropriate care. It is also designed to be a long-term relationship between the healthcare provider and the patient with the goal of consistent care across a broad range of services. Your primary care provider is also serving as a navigator for you in the healthcare system, offering specialty referrals and integration of different services. A successful primary care relationship involves compliance with treatment plans, regular follow-ups, and to achieve this, communication with your primary care office is a key to this success. And virtual care can help us get there easily. So to the aspects of a primary care visit, I would be able to define it into three main things. One is your annual physical exam. We know this by many names: well child for pediatric, well visit for younger adults, Medicare annual visit for our Medicare population. This includes an in-depth physical exam, discussion about chronic disease, potentially updating your labs and vaccinations, and holds a lot of value to many people. Some people look at this as their only visit for the year and then as needed. So this is an important visit that ideally should be done in person. Now, there's a second aspect to primary care, which are follow-ups. Follow-ups are very common, is usually for medication adjustments and or chronic disease management, hypertension, diabetes, asthma, anxiety, depression, and many other conditions which require regular follow-ups to make sure we are optimally treating it. Now, your third aspect is sick visits. So your coughs, your colds, your minor injuries, for which we may need an earlier appointment than what might be available. So we will talk about how virtual care can integrate into all of these, which you may already be doing at this time. So if we have to divide it, annual physical is best done in person at this time, where you can have everything addressed and potentially get your lab work and vaccinations. Follow-up visits are a good place where virtual care can be integrated. For example, hypertension. You talk to your doctor perhaps in the office, blood pressure is high, you come up with a treatment plan for a medication, and then perhaps you can follow up virtually in a few weeks, in a month, to inform how the medication is doing, how your blood pressure readings are, and perhaps changing the medication if needed. So this type of visit can be done virtually if it's appropriate and may not need an in-person visit. Same thing with type 2 diabetes, medications adjusted in the office. You can go home, record your blood sugars, and then follow up virtually with your doctor and see what the next steps are. Similar concept for anxiety, depression, and or any medication follow-up. This can help increase the amount of follow-ups, timely follow-ups rather, and can increase safety, compliance, and better chronic disease management. So I always encourage everyone to check with your PCP and or specialist if video visits are right for you, and what conditions are you and your doctor comfortable with following up on video. Now, the third aspect that I talked about was the sick visits, and these are sometimes well suited to virtual care. These are your upper respiratory infections, COVID-19, influenza, flu, where you might want to not go in an office or you may not be feeling up to it. Uncomplicated urine infection, sinus infections, simple rash, simple injuries, skin infection, minor burns, arthritis, and the list is exhaustive. So these can be potentially be better suited to virtual when possible, when available. There are some things what may not be appropriate for telemedicine. Follow-ups requiring a physical exam, uncontrolled chronic illnesses with symptoms where your doctor might need to call you back for a physical exam, and perhaps lab work or office medications. Major injuries where you would need to be seen in person and perhaps require urgent imaging, severe pain, abdominal, chest pain. So these are the things which may not be appropriate for telemedicine due to some limitations of lack of physical exam. Now, one also important thing to realize is virtual care medicine may not be a substitute for establishing care with a primary provider. As I had mentioned, the PCP is very important. They are your gateway to the healthcare system. They are your advocate and serve as a navigator. So you need to have a primary care provider and work with them for your best optimal healthcare outcomes. Now, sometimes it's hard to know if what I'm feeling, if it's appropriate for a virtual visit or not. You can always use the MyCare advice line at Henry Ford, and they will be able to assist you to see if a virtual visit is right for you. All right, moving along. So we do have some information on the technology needed to participate. As you can see here, you can use your cell phone, tablet, computer to complete the video visit, which makes it very good and flexible. The technology that is needed to participate, which I'm sure most of you have a MyChart account. If not, then I would encourage you to get started with one. We have two options to do it. If you're doing from a mobile device, you would need to have an active Handyford MyChart account. A mobile device, Android or smartphone like Apple, and you have to download the MyChart mobile app from those operating services. Have a working camera and microphone with speakers, which most of us have on our devices, and access to reliable Wi-Fi or cellular service. Now, if you are doing it from your home and have a laptop or computer available, you can do it from Google Chrome, Microsoft Edge, or Apple web browsers, mychart.hfhs.org, and the same thing, working camera, speakers, and accessible with reliable Wi-Fi and internet. Some considerations that you need to make sure is that you have an active MyChart account. It may be that you may have forgotten your password, but you can go to the website mychart.hfhs.org to reset your password, or call the number here, 313-876-7951, and they can help you reset your password or get you signed up on MyChart. And you can also go in your settings section on your device to make sure the app is up to date. And if you're not sure if your camera and microphone is working, we do have a website, techcheck.hfhs.org. This can help you adjust and make sure that your camera and microphone is working. It is always important to make sure you're in a well-lit room that is safe, secure, and private while talking to your healthcare provider via a virtual visit. Some tips for a successful telehealth visit. Please ensure that you are in a safe environment and maintain privacy. Avoid driving while doing the visit. Avoid a noisy environment. If appropriate for the visit, before you join, check your vitals at home, including temperature, blood pressure, heart rate, and pulse ox if necessary. Please have a list of your medications you take and make sure you mention any allergies. The doctor would likely have access to your medical records through their devices and should be well informed of your history while doing the virtual visit. The medical assistant can also help with any technical issues or other questions prior to the visit while they room you in. So I just wanted to highlight a few virtual care services with Henry Ford that we have. We have our video visit on demand, which is a 24/7 video visit option with the Henry Ford doctor, which I'll elaborate in a little bit. We have a scheduled video visit, which you can with your primary care provider or specialist, and you can talk with your healthcare office to see how they can incorporate that. Electronic visit, as we talked about, through the MyChart. Telephone visit. We have clinic-to-clinic facilitated video visit in some clinics. And of course, as many of you have already used, the MyCare Advice Line, where you have a 24/7 nurse on call who can help you navigate some of these challenges and get you set up and running for your virtual visit. Coming on to video visit on demand, this is a great service with Henry Ford, accessible via the MyChart. This service allows you to chat with a Henry Ford primary care doctor on video whenever you need, 24/7, 365 days of the year. We are available to patients located in Michigan and Florida. It is easy to set up. It is through your MyChart. You can use your cell phone, tablet, computer to access it. And it is appropriate for certain medical conditions like we talked about, cold symptoms, upper respiratory, COVID, simple rash, simple injuries, arthritis, and many more. If you have any questions about it, or if you have a condition that you're not sure if it's appropriate, then you can call the MyCare Advice Line and they can assist. Some final thoughts that I have before we open it to questions. I have some ABCs of virtual care here, which kind of defines virtual care like we did, what services we can offer, what technology you may need, and what health concerns are best suited. So to give you my understanding of virtual care, it can offer and enhance your primary care service at this time. A lot of times you may be limited as to how often you can see the doctor based on availability, which is always limited. So for certain conditions and certain follow-ups, if you and your doctor can discuss beforehand, they can be done through video visits, reducing wait times, making it easy on you by reducing transportation, and getting more communication with your provider's office and perhaps better care of chronic diseases. Our video on-demand service also provides great offer for sick visits. And if you have any questions regarding the technology, we do have some resources here at Henry Ford about telehealth access for seniors and the Henry Ford Health virtual care page. And the MyCare Advice Line can help you with some of the things also. I would like to now open it to Q&A, and I will hand it over to Maggie at this time.
Yes, thank you so much, Dr. Siddiqui. This was very informative. And just to reiterate your message about your presentation too, at Henry Ford Health, we believe that healthcare should fit your needs and your lifestyle. So if you have any questions about virtual care options or what those entail, I am dropping the link in the chat on where you can go to find more information. So that should be in the chat right now. So we do have a few quick questions. Is there a cost for a virtual visit?
Many times, insurances do cover the cost of a virtual visit, and your copay could be as less as $0. So there is a cost, but insurances cover video visits. There might be a small copay on your end. I would encourage you to check with the Henry Ford billing office and or your insurance company to see if the virtual visits are covered, but most of them do cover it.
Okay, great. And are video visits just for when you're sick?
Video visits can be used for a variety of healthcare services. When you're sick is one of the ways you can use it because you need a quicker appointment where maybe you are not able to travel to the same day care or urgent care. That would be a great way to access care. But also, video visits or even e-visits or telephone visits can be used as a follow-up metric. For example, blood pressure, diabetes, asthma, where you may not need to be seen in person as a follow-up. So it would be incorporated in that too.
Wonderful. And if somebody's traveled out of state and needs to see their provider, how would that work for a virtual visit? I know you mentioned that you could see a provider in Florida. That's correct?
Yes. So right now we are seeing patients located in Michigan through the virtual service and also in Florida through the video on demand service. But at this time, we offer these services in the current states. If let's say you are out of state and you need something or to let you know of your provider, you can always send a My Chart message or use My Care Advice line. That would still be accessible to you. But the video services would be in patients located in Michigan and in Florida, and perhaps more states to come later.
Yes, that would be great. And all notes from a virtual care visit would be in the patient's MyChart profile, correct?
Absolutely. The virtual
Mhm.
care visit notes would go into the My Chart, and just like any normal visit, your primary care doctor would be able to see these visits and see what was done and even communicate with us if we need to. And at the same way, the virtual care providers can review your chart, prior medical history, medication list beforehand, ensuring the accuracy of the care that they give and ensuring that there's a good follow-up.
Great. We do have a question. Can I do a video visit for a skin condition like a rash? How does it work for getting medication?
Absolutely, that's a great question. So we can do the video visits for simple rashes. Generally, the patient, shows the rash on the camera, and many times it is visible to the provider, and we can make an accurate diagnosis. And the times we cannot, we may recommend being seen in person. For medications, the virtual care provider has access to the same MyChart Epic like your regular doctor would, and they would be able to send in medications electronically and put in referrals electronically where appropriate, just like how you were in the office.
Okay. And virtual care has changed a lot over especially the past few years. Where do you see virtual visits heading in the future?
That's a great question. Thank you. So ever since the pandemic, virtual care is really the next frontier. A lot of our patients and patients in general are choosing virtual care as an enhancing part of their primary care services. So what I'm hoping to see and what will be happening is virtual care being incorporated more into the healthcare system as it offers flexibility, meeting the patient's needs where they are, and improving overall safety and compliance. So I see virtual care being incorporated more in a person's healthcare services, and it will enhance their safety and care.
Great. And what distinguishes Henry Ford's virtual care services from other systems?
Henry Ford is a unique health system in that we have a large system with so many integrated services, specialties, primary care, and they're all under one umbrella, which is very good because our virtual care service has access to all of these resources. So as a virtual care doctor, I am able to review your chart. I'm able to see your visits with your primary provider. I can see what their plan is so that I am also in the same page, and any treatments that I provide would be in conjunction with what your primary care is trying to do and ensure that there's a follow-up. Our medical assistants can also set up a follow-up after a video visit with your primary doctor if it's appropriate. So being a part of the health system, like Henry Ford, offers us this unique capability which other systems may not have if they have video visits outside of an integrated system like this.
Yes, and virtual visits are for every age, correct?
It can be done, and I would recommend you discuss with your doctor to see what is appropriate. For My Care On Demand video service, we recommend age 12 months and above for video visits.
Great. And then more information can be found at henryford.com/virtual care, correct?
Absolutely.
All right. Well, I think those were all of our questions. So thank you so much, Dr. Siddiqui. This was very informative. And thank you everyone for participating this morning. As a reminder, this webinar has been recorded and will be available for additional viewing on the Senior Healthy Living website. So thank you all so much and enjoy the rest of your day.
Thank you.